All right, so as Republicans work on a better bill to replace Obamacare as early as Friday, our next guest says Medicaid reform must be a top priority, blasting it as dysfunctional and in its current form. So what needs to be done? Here to explain, Fox News medical aid team superstar, Dr. Mark Siegel. Dr. Siegel, people keep saying expand Medicaid, and you're saying hold on, fix it first.
Because nobody's looked at that, Brian. 30% of doctors, like me, don't see new Medicaid patients. We know that it's impossible to work with. It's unwieldy. There's too many things with it, too many bells and whistles.
Especially with the expansion. If you didn't like it before, since 6 years ago when you got Obamacare, it's probably more of a challenge.
No disincentive for overuse, no copays, no deductibles. In states that have the Medicaid expansion, emergency room visits are up by 9%. Now, hospitals like that because patients that used to be uninsured now have their Medicaid card, but they're flocking into the ERs to get services they don't often need. Did you know, Brian, that 15% of Medicaid patients are prescribed an opioid every year? Now, that's the doctor's fault for overprescribing. But Medicaid allows doctors to overprescribe, and that's one of the secret stories that we're breaking right now, is that the opioid epidemic is tied to Medicaid as an enabler. Doctors are the problem. Medicaid is enabling it.
So, Dr. Siegel, if I put you in charge of fixing it, where do we start?
Well, I'd scale it back to basic services. What does a person really need? Look, there's a lot of disabled patients, a lot of children that are on Medicaid. There's people that really poor people really need Medicaid. But do they need a wheelchair every 2 years? I don't think so. I want to scale back the excess. And then, as Medicaid Director Seema Verma has said quite smartly, let's have premium buy-ins in the Medicaid expansion states for services beyond what you need.
What does that mean?
How about a bridge to jobs?
I'm sorry, could you tell me, what does that mean?
It means if you want more than the basic services,
okay,
and you have some income, okay, we're talking about the Medicaid expansion states,
yeah,
then you can pay a premium to get more than you would just freely be given. And also, we need bridge to jobs programs in the Medicaid expansion states because people that don't have jobs, Brian, get their Medicaid card and they say, I don't want to give it up. I don't want to give up that Medicaid because I can't afford to take that job. I won't get as good a health care. Now, I'm talking about Medicaid expansion states, and I completely understand that the bill wants to peel that back. I get that, but I predict that a compromise will have to occur. I think that the Democrats and the Republicans have to come together and get a deal going where Medicaid is reformed, revamped, scaled back, and then maybe kept in those states.
Yeah, we'll have to see, because a lot of states are doing well without the Medicaid expansion, like Wisconsin, and others say,
and
like
Florida.
Ohio, we can't live without it. So someone's got to make sense of this. Dr. Mark Siegel, thanks so much.
Great to see you.